Hi everyone, today we are going to discuss about hair loss or alopecia. So whenever people have hair loss, theoretically we think that it is baldness. No, total loss of hair from the scalp is known as baldness. Hair loss has theoretical name of alopecia. So there is no single remedy for alopecia. Because previously during our olden days we used to think that we are changing water, we are changing a place to another place, undergoing stress, or even any vitamin deficiency is contributing to hair loss, and some people used to think that we are not using oil properly, that is causing hair loss. All these are theoretical cause, but practically this doesn't cause alopecia. 5 or 10 hairs may fall, and normally also up to 100 hair follicles can fall per day, but up to 80% regenerate after a period of 3 to 6 months. So whenever hair loss occurs and progressive hair loss occurs, that means that a female or male is losing hair and progressively he or she is losing more and more hair, you should find out a cause. So alopecia or hair loss broadly has 4 causes on earth. Number 1 is Tinea capitis, that is dandruff. Your age is 12, 13, up to the age of puberty, 50% of boys or girls have some sort of dandruff in the scalp. So how do you treat? You treat by using shampoos. Antifungal. Dandruff is caused by nothing but fungus, Malassezia furfur. So you would use an antifungal shampoo, most commonly ketoconazole shampoo, available in our world throughout the trade name of Nisaran or selenium sulfate. Whatever shampoo you use, the dandruff goes and alopecia totally disappears. What's the importance of Tinea capitis, dandruff causing alopecia? You have lack of hair or falling of hair, but hair regrows by itself. No one gets bald because of dandruff or Tinea capitis. It is not the hair loss, it is actually dandruff that is the problem. So most common cause in young age, 12, 15, 16 up to 18 years, is dandruff or Tinea capitis. Second type of hair loss is known as alopecia areata. So the name itself, alopecia areata, means patchy hair loss. Some females come and say, doctor, I was combing my hair, I saw 50 paisa, 2 portions causing hair loss. So ultimately that is known as alopecia areata. So small coin like patches causing hair loss, and once it progresses totally, it is known as alopecia totalis. Some females or men have lack of hairs, patchy, but usually it progresses and whole scalp hair is lost. That is known as alopecia totalis. Some people have lack of loss of total scalp hair with eyebrows, eyelashes, axillary, pubic hair, and all the hair in the body is totally lost. That is known as alopecia universalis. So second and the most disastrous form of hair loss is alopecia areata, totalis, universalis. It is due to antibody. So anti-thyroxine hydroxylase antibody, which destroys the hair follicles, that causes alopecia areata. 30% of such people with a patchy hair loss or alopecia totalis have autoimmune thyroid disease. That is, you have to check thyroid function. 30% may have vitamin B12 deficiency, and all the 30% may be associated with gluten sensitive enteropathy, that is allergy to wheat also. So when someone comes with an alopecia areata, think that it is autoimmune, but always check TSH, vitamin B12, and gluten antibody, IgA, anti-TTG. And what's the treatment for alopecia areata? 30% of the people with alopecia areata, hair regrows by itself. Remaining 30% may respond to intralesional steroid. The dermatologist may give you intralesional local steroid, triamcinolone, they may respond. But 30% of people who don't respond to any treatment, now there is the drug, that is one drug approved for alopecia areata, totalis, universalis, that is a monoclonal or immunomodulator drug, that is known as baricitinib or olimap, that is given approval last year. So it is given in dose of 2 to 4 milligram, which causes remission of alopecia areata in 50% of the people. So understand 2 types of hair loss, Tinea capitis, dandruff. You deal it with the ketodine shampoo or salicin, it will get remitted in 80%. Alopecia areata, spontaneous regrowth, you can go to a dermatologist, take an steroid injection, or third is olimap or baricitinib monoclonal antibody immunomodulator tablets, which controls it in 50%. And the most common type of baldness occurring in men, that is known as androgenic alopecia. You and me, men always have a scalp hair that is thinning. Ultimately they have hair in the occipital area or back area. The most common cause of baldness that is seen in 99% of men above the age of 18 years is androgenic alopecia. The name itself says that it's androgenic, that is male pattern baldness. So once the male or a child becomes an adult, 12 years, 13 years, he is having the sexual development. By 16, 18 years, he became an adult. The body hair increases, chest hair, axillary, pubic hair. But the male hormone causes increased body hair, but decreased thinning and thinning of scalp hair. So this is known as male pattern baldness, androgenic alopecia. We have all the superstars. We see superstar Rajinikanth moving out left, right. He doesn't bother to wear a wig unless he is acting in a movie. So you look at the pattern. They have hair in the above the ear and the occipital area, but there is no hair here. What do people do now? They wait for to be completely bald. Then they go to Turkey or some other dermatology clinic, go for a hair transplant. They take whatever hair from the occipital area and implant it in the frontal area. And now what's the drug of choice of androgenic alopecia? There's a single drug that is US FDA approved for androgenic alopecia, that is known as finasteride 1 mg. In UAE and America it is known as Propecia 1 mg. In India it is known as Finax 1 mg. Finax 1 mg should be taken the time of starting of alopecia. It's no use if you take in a person with total baldness. The moment your boy becomes an adult, 16 or 18 years, thinning of scalp hair occurs. The thick hair is getting thinner and thinner. That's the time where you start the 5 rupee tablet of finasteride 1 mg. And finasteride 1 mg can increase the thickness of whatever villous hairs by 80% within a period of 6 months. So if at all you are having a doubt whether you are having low testosterone, go to an endocrinologist, check the FSH, LH, testoprolactin and start treatment with finasteride. And finasteride is totally approved right from the age of 16 to 18 years till the age of 45 years. So now we have met 3 points of alopecia: Tinea capitis, alopecia areata and androgenic alopecia. Rather than going for a hair transplant after 40 years when you lose all the scalp hair, start finasteride 1 mg and get rid of whatever alopecia and make your hair what is remaining stronger. There is no point in totally bald and taking finasteride. And fourth most common cause of hair loss occurs in ladies, that is known as Telogen effluvium. They come and tell, doctor, my hair losing more than 200 hairs per day. Some people tell, doctor, after my delivery I am losing hair like anything. Some ladies tell, doctor, I stop my menses by 50 or 51 days, I am losing my hair. So that is known as Telogen effluvium, where there is thinning of hair. So that type of hair where there is not a patchy hair loss, diffuse thinning of hair, where naturally you lose 100 hair follicles, there you are losing 200 or 300 hair follicles. So that is Telogen effluvium. In that conditions, check number 1 thyroid, T3, T4, TSH. If hypothyroidism is there, treat that. Check your iron level, that is ferritin. Iron is very much important for scalp hair loss. If iron is low, treat that. If vitamin B12 is low, treat that. If you are having folic acid deficiency or protein deficiency, treat that. So whenever you have thinning of hair with losing of hair, especially ladies after delivery, menopause, check your thyroid, calcium, check your vitamin D, iron, that is ferritin, B12 and protein, that is deficiency, treat that. And rapid weight loss and after pregnancy also you can have scalp hair loss. So these are the four common cause of hair loss. So it can be Tinea capitis, alopecia areata, androgenic alopecia. Men suffer 99% of the hair loss, and 50% of the men above the age of 40 years have androgenic alopecia, and 80% of the men above the age of 60 years have some sort of baldness. The age of 18 years or 16 or 18, when your testosterone starts shooting up, that's the age where you start finasteride 1 mg and continue till the age of 45 years. In females having thinning of hair, Telogen effluvium, check your thyroid, check your vitamin B12, check your vitamin D, check your ferritin, check your vitamin B12 along with your protein. If at all you are having gluten allergy, treat that. Rapid weight loss and pregnancy also you can have Telogen effluvium. Some people, cancer, chemotherapy, you have a Telogen effluvium, losing of hair within 6 months, the scalp hair goes by itself. So at least basically understand there is no single remedy for hair loss. Whenever you are having hair loss, go to an endocrinologist or a dermatologist, find out what is the cause and get treated, and you can live with a normal hair till the remaining life. But don't allow yourself to get totally bald and then starting alopecia. Thank you.